In more news tonight, the protests by nurses and midwives over increased license verification charges has been halted following a meeting with the Health Ministry, Ghana Registered Nurses and Midwives Association, and the Nursing and Midwifery Council.
Also in the meeting were the caretaker minister, Esther Owusu-Ekofo, and the minister-designate, Dr. Bernard Okoboy. All parties resolved to have a reduction in the charges, which have increased from 550 cedis to 3,000 cedis.
No, I'm not sharing any figure with you at the moment. The important thing is that this meeting has had an understanding that there is need to reduce the fee. All parties understand this clearly, and that is good for us. And it will be left with the ultimate entity, which is Parliament, to give approval for any new fee that is reached in terms of how the discussions go at the board level.
The Nursing and Midwifery Council is expected to hold a meeting to bring closure to the matter.
We have seen that over the months and years, even at the level of the Ministry of Health, clearance forms that you need to pick and start the process, the price has been increased over time. We think this is an unfair practice because it looks as if only nurses are having to pay for this clearance form, and we think it's very discriminatory. And as part of these discussions, we are also making the ministry aware that it must review that policy and cut it off totally.
Many have tagged the hike in the charges as one with the intent to deter nurses from leaving the country in search of greener pastures. This is the reaction from the Health Ministry.
Government is trying to expand the health infrastructure system, expand the health base by achieving universal health coverage. So what will be the essence if you finish with that and you don't have your nurses, or you cannot bilaterally train your nurses as well? So being it as it may, we have nurses who want to go out and nurses who even want to come out to come and work with us. The issue they raise is as a result of operational costs, which was even tabled before the Nurses Association. And we believe that when they go and come back, there's going to be a lot of review.
The nurses and midwives have, however, been advised to stay put whilst negotiations take its course, hoping for a desired outcome. What that means is that the protest, which has already commenced by the wearing of red bands and subsequent withdrawal of OPD services, have been put on hold. George Quinnin, TV3 News, Accra.